Tell me something about Sullage management. Yes, sir. The municipal corporation waste normally includes solid and liquid type of waste. In liquid type of waste, there are two main types, namely sullage and sewage. Sullage type of waste is nothing but liquid waste without fecal matter, and sewage is liquid waste with fecal matter. In cases of sullage waste management, it includes two types, namely service type and non-service type. Service type includes night soil collected by the humans and which is not preferred nowadays. Non-service type include borehole types which are old and not used anymore, dug wells type which are also known as pit latrines, and sanitary latrine types which are of three main types, namely Planning Research and Action Institute latrines, research cum action project latrines, Sulabh Shauchalaya, in which the squatting plate is of 3 feet into 3 feet and pipe is of 3 inches into 3 feet, and septic tank. Septic tank is the most commonly used method in India. The minimum capacity is greater than 500 gallons, and inside the septic tank, the sludge is allowed to ferment using the microbes, and the microbes ferment the sludge using anaerobic digestion. And after the anaerobic digestion inside the septic tank is completed, then the sludge water is removed outside of the septic tank, and aerobic digestion occurs outside the septic tank. And for the for the new septic tank, raw material called as cedar, which is the sludge collected from the previous septic tank, is used. And aquaprime has complete water, and it and anaerobic digestion of fecal matter takes place in aquaprime. Okay. Okay. Tell me something about Vision 2020. Vision 2020. Yes, sir. Vision 2020 is a global initiative which has been launched by the WHO in 1999, and India adopted this initiative in 2001. There are two main aims of Vision 2020. One is to reduce blind people to 25 million by 2020 and to eliminate avoidable blindness by 2020. The diseases covered in India are cataract, trachoma, glaucoma is the last disease covered under Vision 2020, refractive errors, corneal blindness, childhood blindness, and diabetic retinopathy. And the diseases which are covered globally are cataract, trachoma, onchocercosis. Okay. What do you mean by preventable causes of blindness? Yes, sir. Preventable causes of blindness is that which the blindness can be prevented by attacking the causative factor at an appropriate time. Examples include vitamin A deficiency, measles, trachoma, conjunctivitis, ophthalmia neonatorum, and retinopathy of prematurity. The elimination of preventable blindness is very is very similar is very is done by providing measles immunization, vitamin A supplementation to the newborn, and maintaining oxygen therapy in cases of ophthalmia in cases of retinopathy of prematurity, and avoiding harmful traditional practices to prevent causes such as trachoma and conjunctivitis, and then providing eye health education in schools, and then providing programs for screening so that refractive errors and cataract like conditions can be prevented earliest. Okay. Okay, fine. Tell me something about Ellen's test. Yes, sir. Modified Ellen's test is a test which is done to evaluate the collateral adequacy. Is done to evaluate the collateral adequacy for the collection of arterial blood gas sampling. in which the patient is initially asked to clench his or her fist, and after clenching his fist, both the collateral and the radial arteries are occluded. And after occlusion, the patient is asked to unclench his fist, and then we have to observe for the paleness of the hand. And after observing for the paleness of the hand, if then after observing for the paleness of the hand, the finger on the ulnar artery is removed. If the hand returns to pink color within 5 to 15 seconds of the removal of the finger from the ulnar artery, it indicates positive Ellen test. It indicates that the radial artery is patent, and hence we can poke the radial artery for collection of blood for arterial blood gas sampling. Okay. Tell me something about SVT and its ECG findings and management. Yes, sir. SVC means supraventricular tachycardia. It is also known as paroxysmal supraventricular tachycardia, and it is mainly due to the AV node re-entry loops, in which the atria and the ventricles both are depolarized simultaneously because of the re-entry loops. And because the re-entry loop pathways conduct much more faster than the AV node, and hence the ventricle rate is more than 100 beats per minute. And in the ECG findings, since the atria and ventricle depolarize simultaneously, E wave is absent, and RR interval is of regular type. Regular RR interval is present, and the heart rate is greater than 100 beats. And in the management of paroxysmal supraventricular tachycardia, if the patient is unstable, suppose as in the patient where his systolic blood pressure is more than 120, or the patient has cyanosis, or there are crypts in his chest, in those cases DC shock of 10 to 50 joules are given. And in the cases where the patient is stable, then initially natural methods such as carotid massage is done so that it increases the vagal discharge. If there is no response on doing the carotid massage, then the drug of choice which is given is intravenous adenosine. Intravenous adenosine is given 2 times. If no response is seen even after giving intravenous adenosine, then DC shock is given. Okay, thank you, sir. Tell me about the national health programs. Yes, sir. National health programs include Revised National TB Control Program, popularly known as RNTCP, in which Nikshay and Nikshay Poshan Yojana are included. The second one is Reproductive Women, Mother, Neonate, Child and Adolescent Program, in which there are various programs for adolescent age group, child and mother. In adolescent age group, the programs are Weekly Iron Folic Acid Supplementation Scheme, Rashtriya Kishore Swasthya Karyakram, and for mother, they are Nishchay, Janani Suraksha Yojana, Janani Sisu Suraksha Karyakram, Pradhan Mantri Surakshit Matritva Abhiyan, सुरक्षित मातृत्व आश्वासन, लक्ष्य दक्षता. For child, the programs are home based newborn care scheme, facility based newborn care, Navjat Sisu Suraksha Karyakram, Indian Newborn Action Plan, Rashtriya Bal Swasthya Karyakram. The third program is National Vector Borne Disease Control Program for the communicable diseases. The fourth one is National AIDS Control Program, then National Leprosy Elimination Program, and lastly ICDS, Integrated Child Development Services.